Officials in Mozambique announced Wednesday that the first 5 cases of cholera have been confirmed in the port city of Beira. Efforts are underway to prevent the spread of the disease among survivors sheltering in squalid camps.
Cholera is an epidemic situation. You see, when you have one case, you have to expect that you will have more cases in the community. Therefore, the health workers are there in the communities, work hard with communities, how to organize them, how to prevent, how to treat water and everything to prevent the spread of the cholera.
Paris-based humanitarian group Doctors Without Borders has sent 3 planes to Mozambique with emergency supplies and personnel to aid the effort.
In this plane is mainly logistic item, tent, mosquito net, administration kits, toolkits, water and sanitation, chlorine, what is needed to really start the operation.
The group's medical staff is treating the injured and vaccinating survivors against infectious diseases such as tetanus. Emergency coordinator Dr. Axel Rons says securing food, shelter and clean water is essential.
If not, then we will face respiratory infection, diarrhea, all disease related with water, not clean water, all disease related with no sanitation, and after all disease linked with a vector like mosquito breeding in this new clean water coming with the rain, and it means malaria, dengue, leptospirose, yellow fever, and all these kind of disease that you have usually like 4 weeks after the big rains.
Dr. Rons says it is also urgent to treat people for trauma so they can engage in helping their community, especially if foreign aid workers don't speak a local language.
But the idea is really to hire them and to reach the community, to explain why we are here for, what we can bring to them, and especially when you do kind of distribution or bringing them this tablet to chlorinate the water, you also have to explain how to use it and where they can go if they have any kind of disease starting.
Officials say another challenge is to get food to remote and isolated communities. United Nations World Food Programme says 1.7 million people are in urgent need of food, and that the shortage will continue because an estimated 400,000 hectares of crops were washed away just weeks ahead of the spring harvest. Zlatica, Hoke, VOA News, Washington.